Namaste. In this video, we are going to see certain clinical related process for all the nursing supervisors. The first one is clinical assessment, and who is going to do the clinical assessment and who is going to take the complete ownership for this clinical assessment. In each unit, we have a lead physician who is supposed to do the clinical assessment and understand the case as the clinical requirement of the cases. All the cases is mandatory to undergo the clinical assessment by the unit physician before enrollment. And next one is we need to understand certain clinical outcomes or outcomes for this clinical assessment. The first one is assess the service feasibility. The doctor has to assess clinically whether this particular lead or case can be handled by our nurses. Next one is confirm the case category. So through the clinical assessment, the physician from the unit will confirm which kind of category for this particular case. Example, it is advanced or basic or specialty or critical tracheostomy. So we have certain categories. So this clinical through the clinical assessment, our physician will confirm the case category and follow the defined nurses deliverables. In each case category, we have set nurses deliverables already there in our service agreement. So based on the category, the nurses and the particular nurse category nurse will follow the set nurses deliverables. And next one is recommend other clinical requirements of the client. If there is any kind of clinical requirements for the particular client, that can be recommended by the unit physician. And based on the patient need, we'll start special procedures at the bedside. So this can be possible when the physician will assess the patient clinically. So these are all the main good outcomes for the clinical assessment. And next we will see, as a nursing supervisor, you have to keenly monitor about how the nurses are doing the handover and taken over the cases. So that is very important. And in our Apollo Home Care, we have a standard protocol and then standard format which is which all the nurses are following. So in this safe PT, so we have certain parameters supposed to be assessed and monitor. So safe PT in the sense S means situation, A means assessment, F means follow up, E means events, and pending P means pending, and T means it is team details. Okay, so situation in the sense we have ADL. ADL is activity of daily living. So whether this patient is independent, partially dependent, or whether completely dependent, this can be assessed by the nurses in every handing over time. And fall risk assessment also, it has to be assessed every time by the nurses, at least every day once. So whether it is mild, moderate or severe. And pain score, there is a numerical pain score we are following 0 to 10. Whether what is the pain level also, score also has to be assessed by the nurses. And assessment. So presence of any medical devices or tubings and connections. Example, patient has Rice tube, Follis, IV cannula, PEG feeding, tracheostomy, jejunectomy, and BiPAP, CPAP, ventilator, oxygen connection, and support, any other support. Okay, so this all has to be assessed by the nurses through the assessment, and presence of wounds also. If there is every day they have to do the skin assessment. In that they have to assess whether any bed sore being developed or any surgical wound. What is the condition of the surgical wound? All these things has to be assessed by our nurses. And follow up. Any recommendations or any other specific instructions, maybe infection control or diet advices or any new medication being started. So any of the follow up or strictly we have to follow up. It may be a simple also simple nursing intervention, but still we have to follow this. So what are all the follow up or recommendations we have to see to it. And events, any untoward or any emergency alerts or red flags Example, patient has sudden chest pain or nose bleeding, or patient has passed more than 4 5 times stool, loose motion, or patient had more than 4 times of or more episodes of vomiting. So these all red flags has to be events has to be monitored and enter here and document. And any other pending, any procedures or any other medications or anything is pending for the next shift has to be supposed to inform to the next duty or next shift nurses, and team details that who is outgoing staff, who is incoming staff, that detail with employee ID and proper signature. This everyday basis they have to do the handover. So this handover they cannot do anything vaguely, patient name, all those things. They have to use this tool. Based on this tool, they have to follow the handover. And next, we have equipments which is supposed to follow. Okay, so or which we are handling in the patient side. So this equipment has to be clean everyday basis. We can say consumables. For example, stethoscope, infrared scale, or glucometer, thermometer. Okay, BP cuff, cardiac monitor, ECG machine. Okay, all the things has to be cleaned properly. So this is the equipment checklist we have. So usually we are using normal isopropyl alcohol swab, or soap and water, or Basilol. Okay, this all has to be clean. So we have given here that after every use or OD. OD means once in a day. After every use, for example, stethoscope, thermometer, okay, and then this all has to be after use. We have to use even cardiac monitor, ECG, okay, and then urinals, bedpan, okay. This all has to be every use. We have to clean it, okay. So we have see here soap and solution. So how we have to clean it? How this equipment checklist has to be maintained. So through this equipment checklist, we can understand the particular equipments after the use or once in a day, whether it is cleaned properly or not. This has to be monitored by the nursing supervisor also, whether they are maintaining properly or not. Okay, we can see here there is a bed linens. Okay, whether they are changing and then they are cleaning properly. Okay, and then this all has to be nebulizer or any belt, cord, oxygen mask. Okay, this all has to be properly cleaned, syringe pump, infusion pump. So we have a protocol with what solution we have used, whether it is Dettol solution, Basilol spray. This all has to be followed strictly and then signed. So each time the nurse and morning and night we have to check properly whether this equipment's been cleaned properly, and then we have to put a signature. Next one is we have SCM, that is supply chain management. So in each unit we have a SCM team. They are coordinating with the nursing supervisors and the nurses, and their main role is in terms of supplying the medical equipments, all kind of medical equipments, right from the beginning. This oxygen concentrator, oxygen cylinder, cardiac table, multipara monitor, ventilator, and then Fowler's bed, cord, suction apparatus, all kind of medical equipments, including wheelchair, walker, cane, commode chair, all those medical equipments and consumables, all mask, gloves, Koshi sheet, patient diaper, gloves, everything, all consumables and non-consumables like vital signs articles, then other like BP apparatus, stethoscope. So all these consumables and the medicines, if the patient needs any kind of medications, and then sleep study, Holter monitor connection, and ambulatory BP monitoring. These are all the various vertical or facilities available from the SCM team. It has to be coordinated properly and get it done. And next one is how we are connected, because this SEM team has to be closely connected towards the supervisor and the nurses. The nurses are main because when the supervisor is going on the first shift to enroll the case, the supervisor and the nurse, both of them actually properly assess what is the important and medical requirement and need for the particular patient, because they both are really on the field on the patient side. So they can physically assess exactly what is the requirement of the patient. Then based on that, they can coordinate with the SCM to get all kind of things. And certain operation related documentation also we are maintaining. For example, we can divide this requirement into two aspects. One is clinical related, other one is nurses related. Clinical related operation document, we have a service agreement, we have site assessment and site readiness, SPOC form and tariff conservation form. Means service agreement where this agreement has to be read by the client or attender, and then they have to put signature on the end of this service agreement form. Okay, and in this agreement form, we have very clearly given where each category of case category and what all the nurses deliverables and the check-in and then into mark is there. So what all they will do, what all work they will not do. Okay, so the client or the attender will get a clear idea about what all nurses deliverables they will do it. And next one is site assessment. As you all know, before we are going to start the case, the nursing supervisor has to physically visit the patient home, understand where is the home, the location, proper address with landmark, and from the house to bus stop, how many kilometers or meters, and is the site is safe enough for our nurses, whether patient has separate room and then nurse has washroom facilities and how many people are staying, what language they are talking, and if the female patient, whether the patient has female attendant or not, all these things has to be assessed because site assessment is a kind of safety, okay, safety check for our nurses. And site readiness is all the critical care patients and tracheostomy or the client who is going to buy all kind of medical equipments. Okay, so this for this client we have to do the site readiness. So before the client is shifting from the hospital to home, the nursing supervisor has to coordinate with the SCM team and understand whether all the equipments being delivered or not. Once it is delivered, he has to go physically and arrange all the equipments and check whether it is physically present and functionally also working properly. Example, if suction apparatus, they are seeing whether it is put in the plug point, whether it is working, suction pressure is proper or not. So all those things he has to check. So all kind of critical and tracheostomy or patient those who are taking all equipments from our AHC Apollo Home Care, we have to do the site readiness. And next one is even the site readiness, the nursing supervisor has to assess not only the equipments, even the physical environment of the home, whether lift means how many people capacity, if medical equipments cannot be shifted to the lift, the ramp facility is there. How we are going to shift the patient in the lift or the ramp or any other facility. So this all has to be assessed. The complete environment also has to be assessed through the site readiness. And we have SPOC form, that is single point of contact. So each case when we are starting, there is a form which is SPOC form. So in this form, we have a separate column for the nursing supervisor and doctor signature with their contact number. At the same time, we have a one SPOC person from the family who is going to take financially decision or the head of the family or who is going to take the decision on the patient. Okay, to that person because there will be a three, four members. So we need not to explain all the things to all three, four members of the family. So instead, there is one spokesperson. All communication related to patient condition, other issues or other informations we can share to the one particular spokesperson. So that has to be get signed on the time of enrollment by who is spoke. That signature has to be there in the spoke form. And tariff confirmation form, once a PRE confirm the tariff and then it has to be properly communicated to the SD team and then it has to get confirmed and through the pre-enrollment call even the SD team will be confirm the tariff also. Okay, and nurses related operation documentation is scorecard. Yes, operation team is separately maintaining the scorecard. In this clinical aspect, the nursing officer will take it, and then operation related, the operation team will take it. So any duty refusal, using the phone, and argument, and not attending the calls, okay, and then sharing the personal things, and then going very late to the patient customer side, okay, and any abusement, so harassment by our nurses, very rude behavior, all those things has to be considered as an operation related issue, and then in this we have to enter all this thing in the scorecard. And mismatch consent form also, because if the patient is asking basic care, but where the case is supposed to handle by the advanced care as per the clinical assessment by the physician, but patient is requesting for the basic care. In that time, we have to take a mismatch consent form, because this nurse will do only the basic care procedures and she cannot do the advanced care procedures. So that the patient also will be in a clear idea about what is basic and what is advanced. This kind of mismatch consent also will be the operation related document where we have to maintain them. Okay. So thank you so much. Hope this video will be useful for you all. So we'll see the next video. Thank you so much.